from April 2025. Thank you, Dave, for starting the recording. And for colleagues that haven't joined a member webinar before, we record the meetings so that we can then make them available on our website for those that aren't able to attend. So if you don't wish to appear on the recording, then do by all means turn your camera off and put yourself on mute. However, I do hope that throughout the exercise, the webinar, I should say, you are able to contribute. If not verbally, then certainly we've got the chat function available this afternoon for you to use. Having a look at the attendees list before joining, I can see we've got a good mix of people from NHFT governors, board members, staff members, and also partners, members of the public, and probably some carers as well, I would hope. So we've got a good range of people this afternoon, so I'm really looking forward to the discussion that we're going to have. So I think with that, Alison, I'm going to hand over to you, if that's okay, to start the ball rolling.
Okay, thank you, and I'll just do a quick introduction just in case people can't remember me. I'm Alison Gilmore, I'm Director of Strategy and Partnerships for LPT and NHFT, and I've been working with my colleague Glyn and others across the trusts, both trusts, to shape the strategy for your future. And it's really exciting. I think we've turned a bit of a corner this week in that we've been working in the background to get the final draft of the strategy document complete for you, and you'll be pleased to know that we have got that final draft to a point whereby we can take it through to our executive board next week to share with them and to get their thoughts and comments, and it will be further progressed and finessed at a joint board-to-board session at the end of February. We will, however, once that has been shared with our executive colleagues and that board-to-board, and we've done that second round of finessing, we will be in a good place to start thinking about sharing that document with you all. So it's really, really great news. The work in the background has progressed really, really well. And we've started the next phase of the strategy development, and that's thinking about how we can embed it across both organisations going forward. But that's a story for another day. Today, I just want to get more thoughts from yourself, and I've got a few slides to help me on that sort of journey, on that conversation. So I will share my screen now, and we will just sort of work our way through these. I promise it's not going to be death by PowerPoint. I value your thoughts and comments along the way, so please do feel free to stop or interrupt, but equally use the chat function, or we can have a conversation at the end of the slide deck. So I think firstly, just to say a huge thank you to everybody who's contributed to the feedback in phase 1 and phase 2. The feedback has been absolutely fantastic. We've had some really good sessions, both internally and externally, a wide audience. We've spoken obviously to yourselves, we've spoken to our expert patient groups, we've spoken to our staff, our workforce. Everybody has had a really given us a really positive and welcome reception when we've taken the discussion out to them in all of the group meetings and their team meetings. And we really have hijacked team meetings and sort of intruded on their space and their time. And they've been really welcoming. So huge thank you to everybody who's contributed. As we promised, we said we'd go into phase 3 and that we would be looking to seek your final views on the strategy document, sort of like some of the high level themes. I can't share the document with you as yet, but as soon as I can, I will do, I promise. Just so we can make sure that what we've heard in phase 1 and phase 2 has been correct, and sort of to give you an opportunity to further reflect and add any more thoughts to before we move forward into that final version. So the feedback so far has been used to create 6 strategic themes, our mission statement and our vision. So what I'm going to do today is just revisit that vision and that mission statement and revisit those 6 strategic themes. And then I've got a couple of questions to pose to you that are really, if you haven't got any other comments or any other thoughts, but a couple of questions to pose to you in terms of some feedback. And then obviously there'll be an opportunity for you to link on to that famous QR code and go back in and use that to answer the questions separately in your own time when you've had more time to reflect. Judy, I have to say this, you must be walking. It is most bizarre. While you're swaying from side to side, you look as though you're on a boat. So, okay, so I will move on into the next slide. So what we've heard, and this is the first time I've used the slides, so forgive me just if I keep looking over the other screen. It's I've not got used to using them yet. By the time we've finished the round of discussions, then you're fully au fait with them, but first time around I just need a few prompts. Okay, so your top 5 priorities, which you reflected back to us. You talked about responding to patients, to service carers and families and their needs. And that absolutely, why wouldn't that be a priority, top of the list? And we heard that really, really loud and clear. People told us that they wanted accessible and inclusive services for all. And again, absolutely makes sense in terms of what we do and why we're here. I don't think that would be a surprise for anyone. You've talked about delivering safe and compassionate care. You've talked about collaborating with our communities and our partners. And I think that came across loud and clear. That theme of co-production, of doing things together. So that old adage of nothing about me without me, and people being part of that journey. So it's not just about engaging, it is about actually involving people in our decision making, involving people in how we deliver our services, and ultimately involving people in terms of critiquing and evaluating the services that we're providing to make them better going forward. And we heard that all the way through. And that feeds and talks to that last point, and that is listening to, valuing, supporting and caring for our workforce, because equally that they wanted to feel that they were engaged and fully involved in terms of developing, delivering and evaluating services going forward. But I think valuing and supporting and caring for our workforce is one of those things that is an absolute priority. If we look after them, they will look after our patients. And as a nurse, I genuinely believe that. So over the course of the summer, you've helped us draft that vision and that mission statement, and we use phase 1 feedback for that. You've also informed and supported the development in terms of the ambitions of the strategy and those 6 key themes, and I'll come back to those in a moment. And that was influenced and shaped by the feedback in phase 2. But from that feedback, an overwhelming majority of people in phase 2 have confirmed that the draft strategic themes feel right, they're what they would expect, and that the mission and the vision were widely liked. So that's where we've got to so far, and this is what you've told us, and you'll just see some figures at the bottom there. So over 2,461 people, so that's staff, patients, family, carers, service users and other stakeholders, have helped to shape those strategic themes and our vision and our mission. So again, a thank you. If I just move us on to the next slide. So just a reminder then of what that draft group vision was. And again, this is just testing it out, just landing it again, just to make sure that we have absolutely got it right. So together we thrive, building compassionate care and wellbeing for all. And you'll see there's some bubbles around that screen explaining and giving a bit of a rationale as to why we've looked at using that sentence. So really thinking in terms of together we thrive, emphasising the fact that we're working in partnership, we're wanting to enable self-care and prevention, and we're really thinking about innovation and creating that culture whereby both our workforce and our patients have got the ability to thrive through the support that we can offer. Building is that active word, that doing word, thinking about how, really emphasising and reinforcing the fact that we are going to be working together. We can't do it all. We need our workforce to help us do this, and we need our patients and our carers to take responsibility and ownership for the parts and the role that they can play in terms of the services we provide going forward. That compassionate care and wellbeing. We provide a caring service. That's what we're here to do. But I think we recognise that we've still got some work to do in the compassion space. It has been a priority for a while now. But we're not saying that we're absolutely there 100%. And there's we can never say there's not room to improve, and it's something we want to continue to emphasise. So really thinking about needs-led, evidence-based care. Really highlighting that importance of compassion as part of our organisational culture overall. Wellbeing, emphasising that it's not just mental health, it's physical and mental health care combined, really, and thinking about the future as well in terms of how we can invest and support the early intervention and prevention agenda. And thinking about that for all piece, and that is that inclusivity piece. That's about everybody, making sure that we're improving equity and serving our community. So where we've got those harder to reach populations, our ethnic, cultural minority communities, really making sure that they are able to access services the same, as their white colleagues, white patients, white partners, etc. Okay, so next slide. Do stop me if I'm going too fast and you want to come in. The group mission, just testing this again then, making sure that it was right and that we got it right in phase 2. So we've stuck with making a difference together. So that making a difference, really emphasising and talking to the fact that we're going to be continuously improving, and we're going to start on that improvement journey and doing quite a lot of work around that internally. Thinking about how we're responsive, how we're providing person-centred and evidence-based care, really thinking how we can bring research and innovation forward, thinking about how we can have those conversations across the board. Then together, again, talks to that all-inclusive piece we've talked about for all, and we're talking about together. So working in partnership, thinking about co-production, making sure that what we're doing really does benefit all and provides people with an opportunity to optimise and maximise the life that they're living. Finally, then, this is where we get to the strategic priorities and the 6 strategic themes that people felt really strongly about and that we pulled out in terms of, keywords that we used, in terms of frequency, the messaging that we heard. So using that qualitative and quantitative approach to analysing the feedback that we got. So we have come up with another anagram. This time we've got a real word. We haven't got a made-up word. And we were looking or proposing to use the word thrive to frame our 6 strategic priorities for 2025 through to 2030. So what we've come up with is that T for technology, H for healthy communities, R for responsive, I for including everyone, V for valuing our people, and E for efficient and effective. So talking to same coin, 2 sides of that coin, the efficient being value for money, making sure that we're delivering services in budget, and the effective, making sure that they're of high quality. So that really talks to that. So that's where I'm going to pause, and a couple of questions, I guess, for you to think about. And I guess we thought about these questions long and hard and thought, were they appropriate for the audience today? But I think I'll probably frame them a little bit differently. So in terms of what does good look like, I think that's still relevant. I would like to understand from you what good looks like, what it should feel like, what it looks like for you. It will mean something completely different to me. It will look very different to me. And that question about how do we achieve these goals, I just want to put you put you in maybe in Angela's shoes or one of our operational or service managers' shoes. What do you think we need to do? What do we need to do differently between now and 2025, 2030 to realise our ambitions to deliver this strategy? A couple of really big questions there, and I'm going to pause and hope that you can sort of reflect and give me some feedback now, but understand if that's quite a lot of information, if you want to take some time and obviously use that QR code in your own time later. So I will pause there. Jo.
Shall I start off and then
that would be wonderful.
It'll just help people just feel comfortable in contributing. I think, I mean, it's as somebody said in the chat, it's a really good way to present information, Alison, and for the first time of seeing it, it's quite easy to grasp the key themes. And I think, the key themes do seem familiar. I think the bit that I find a bit invisible, or just maybe it's too subtle and I'm missing it, is that whole agenda around prevention and early intervention.
Mm-hmm.
And about not necessarily us doing everything, but how do we help people to find the right support? so that when they need the safety net of NHS support and intervention, it's there. But in the first instance, there are other options, some of which might be about healthcare, some of which might be about pharmacy, some of which, NHS 111, and just making sure that we have that sort of that agenda reflected back to communities and and staff in a way that is not seen as patronising or deferring our responsibilities in any way.
Yeah, absolutely. That's really helpful, Jo. Thank you. Okay, Nicola.
Yeah, that's interesting you say that, because I feel that the prevention piece kind of sits within that healthy communities priority. I think. Sorry, go on.
No, you get Karen.
No, I was going to go on to something else from that, actually. It was just while I was looking at it.
Okay, but I think as Jo has reflected, we will obviously, there will be more detail. We'll be expanding on these key strategic priorities and themes, and it could absolutely, as you say, sit in that healthy community space. I think, but Jo, I think you're absolutely right. At the moment, it is not hugely visible. It's not obvious. It would require more expansion and more detail to make it so. Okay, so Nicola, did you want to carry on?
Yeah, so just a comment about the Thrive. I know we're supposed to be looking at how do we achieve these and what does good look like. It just, the technology sitting right at the top of that might be a bit uncomfortable for some people to see, because it feels like that's your top. I know it's not, but it looks like that's the top priority. It'd be great to see all of the different services and like from the top down having action plans related to these, and that will be asking them, how are you going to achieve these things? For my teams, that would be quite easy, quite easy to do, and it feel like we're contributing towards that strategy rather than it just being a overarching strategy. This is, these are our themes, but what you're doing about it. I think the other thing is, sorry, I'm just looking down. No, I was just but the comment I was going to make was around access. Access is a real issue for us. I suppose it fits under being responsive, and again, it goes back to working together, doesn't it, with our partners to enable some level of support, even if people can't actually get into NHFT services.
Mm-hmm. No, I think you're right. We had, the conversations that we've had behind this have included sort of access, and we included that under the responsive piece. But I think what you've just reflected is really helpful in terms of the ownership and what sort of the next steps and what we would do in implementation. And our thoughts were that we would be looking at our enabling directorates, so corporate functions, and our care pathway delivery groups, which we would be asking them in the way that you've described to demonstrate how they are delivering against each of these strategic key themes. And for us, that felt as though it would increase that ownership, and that they would recognise and would be able to demonstrate very easily how they're progressing in terms of the delivery of the strategy over time. So that's really helpful. No, thank you. And yeah, I get what you're saying about technology being up there. I think what we need to emphasise, it's not in any particular order of priority. So, but I understand what you say in terms of first impressions. So thank you. That's helpful. I'll take that away. Okay, so Michael.
Oh, yeah. Hi, thank you. So I think I might just sort of repeat some previous comments. What I like, I think, in terms of presentation, and a lot of the presentations we have, is the collaborative story. And I think in terms of context, it would be really good to highlight the journey that the trust is on working within the new system, and those collaborative relationships, because I think then staff and people who use services will sort of will understand the context in which everybody is working and moving forward. I think collaboration is a great word, but obviously it has different references to different people. So as I said, I think when we have our conversations here, the story about the journey of working together is very good. So somehow you can articulate that, and then just picking up on well-being and self-care. I think there's something about honesty in terms of about people who use your services, about your responsibility and our joint responsibility. And it's not deflecting, saying that we're not here to support you in certain, but I think there is something around re-cementing those conversations in terms of the public health story or message, sorry, about joint responsibilities, because I think that will strike with the generational sort of gap as well. And my third point is, yes, to make sure that I think in terms of technology, it's a challenge, because of course we mustn't forget people who aren't comfortable using technology, and maybe there are different ways that staff and other services can help people with the use of technology. And then my fourth point really is I'm trying to think of what would it be like if I was a member of the team or a service manager. And I think in terms of what would good look like, I think it's really having those honest conversations with staff about managing expectations and what's a reality. And I think there must be nothing more frustrating in year when different national priorities kick in, and then that seems to sidetrack progress in respect of the areas that you're making. And I think particularly with the Thrive analogy as well. So thanks very much.
Thank you. And that was really well thought through and really comprehensive feedback, Michael. So thank you for that. I've captured as much as I could. I will be relying on the recording to make sure I've got all of the detail. Brilliant. Judith.
Yeah, thanks, Alison. Obviously, I'm in a position where I've seen this and heard your presentation and seen the development of it. So I'm sort of totally behind the concept and what you're trying to do through the strategy. However, and I'm looking at the second question of the two that you've asked us, which is really what does good look like? For me, and this touches on a number of points. It touches on the point that was raised around thrive as a word being used and how that does not resonate with people. It touches on Joe's point as to, well, where's prevention in all of this? It's really around the second layer of the strategy as to how it is that we're going to use our position as an anchor institution to bring about better, if you like, health, better outcomes through prevention for our communities, through putting into effect the three thrusts or three new visions, or what are they going to be called, of the NHS long-term plan, which is around digital, about the shift to the community, and also what we're going to do about our estates, because as an NHS, as an NHFT trust, as a trust of the NHS, we do have issues around our estates. What we're doing about sustainability. This is very silent on sustainability, and sustainability goes hand in hand with a value programme and also with partnerships and collaborations. So it would be good to see some of that being flushed out, but I recognise that's going to be in the second layer, if you like. But that's where I'm driving when I'm sort of looking at your question and how to answer your question as to what does good look like. Good looks like, if you like, addressing all these separate points through the strategy and having our board assurance framework addressing all of these risks. So we know we're driving towards, in 5 years' time, delivery under all of these heads. I hope that makes sense.
It does, it absolutely does. And this morning, I was really lucky yesterday, actually. I got a chance to go to the ICB meeting in Northamptonshire to talk about what we've been doing as an anchor organisation and present our social value work. And I think it was really clear from the room and people in the room that we were quite a way ahead of the game, I think, in terms of where others are at. And the story and the journey that I could describe kind of demonstrated how far we've come, but it also made me refocus on what we need to do next. And I think definitely, I think you will see that coming through the strategy, Judith, and I hopefully will be reassured that we'll be able to demonstrate that progress, as you say, in that detail going forward. Richard.
Thanks, Alison. Yeah, I was just going to throw in 3 points from my perspective, which are hopefully helpful to others too. I think from the question, what does good look like? I think for me, it's that everybody across the group is inspired, engaged, and able to succeed together. So it speaks to the point, I think, about how people respond and use the strategy then to do what they need to do, whether they're a patient or a carer or a member of staff, actually. So that, I think, for me would be the touchstone. And then the 2 other points I wanted to raise really related to things outside NHFT, really, because I think it might be helpful just to illuminate those in the context of the strategy. The first was then national policy. Of course, we've heard a little bit about these 3 big shifts that Wes Streeting as Secretary of State and Department of Health and Social Care are pushing as a plan for the NHS in England across the country. And that's obviously moving from analogue to digital, from hospital to community, and from crisis to prevention. So I thought it was possibly helpful to draw the link between some of the decisions that we're proposing to make with our Thrive strategy and how that then relates to us delivering as part of the wider NHS on some of those priorities. So it may be helpful to others if you were to say a little bit more about some of that linkage, Alison. And then the other point I was going to raise was one of the key differences, which for me is quite exciting and an opportunity, is that in contrast with Digby Q, which in inverted commas just NHFT's strategy, this is proposed as a strategy for NHFT, LPT as a group. And I just wondered whether you could say a little bit more about what you sort of see as the opportunities for us as a group, as well as for us as a trust coming out of this new process. Hopefully that's helpful. Thanks.
No, that's really helpful. I'm not going to propose to answer those questions now because I think they're big questions. But I think in terms of the opportunities around the group strategy work, I think we've already started to see that emerge, even over the past 18 months with the group work that we've been doing, our shared priorities, and it's really shown how we can take learning from each other and drive things forward. So we've looked at our role as anchor organisations, the social value piece, inequalities. We've got QI programmes and projects that are up and running across the group. That's really giving us some fantastic outcomes. And the Together Against Racism work. So I think we've got some really big ticket items where we can already demonstrate we've got that shared opportunity for learning. And I'm sure that will continue to feature and build in the new strategy. Really helpful. Thank you. Any other thoughts? Any other comments? See some comments in the chat, which is great, and I can take those back. Thank you. There's something there that good looks like for you is leadership, ensure smart foundations, safe practice, developing the workforce, and empowering people, improving care pathways. That's really good. Thank you. I'll read a couple of these out. What else you've got? Will we be able to do something with the strategy to create or win hearts and minds, to create positive business results? Do you like just to expand on that a little bit more, or is that something you prefer to feed back in your comments? Do you mean because?
Yeah, so really, probably where I'm coming from is just sort of aligning it. I like how, firstly, the presentation it's understandable, it's clear to the point, very concise. So very well done for that.
Can't take credit for that.
Certainly keeps you engaged anyway. So well done on that. But I suspect where I'm coming from is where we're going to sort of start aligning the strategy to create that sort of cooperation and a sort of a fashion towards moving to that common goal, really. I could probably expand a bit more on it, but just initially, I'm just going by what I'm reading and just putting my thoughts on.
Yeah, that's really helpful, and look forward to your response.
Okay.
Answer the questions. Thank you. Right, I've got a couple more hands up, Richard.
Thanks, Alison. Yeah, I was struck by, and we've got some governor colleagues on the webinar this afternoon, and obviously we've got the QR code which allows people to feedback after the event. Is there a deadline for that feedback? And it would be probably helpful for us to mention this at the Council of Governors so that we can then go out and engage with more people to get some more feedback if that's what's helpful to you. So you know, to say a bit more about the timeframes and the requirements for feedback.
Yeah, no, that's really helpful, Richard. Good prompt. So yeah, the timeline in terms of the deadline for feedback is the 28th of February. So we're going to be working really hard over the next month now to take this discussion out to as many people as we can again. So any help that you can offer in that space by taking it back to your respective teams, to people that you see on a daily basis, then please, we would really encourage that and welcome that support. So we'll share this slide deck with you after the meeting so you can use it in the same way that I have today. Nicola?
Yeah, I was just thinking about getting buy-in across the trust, and I was just wondering, you know, we have had R&R days in the past. It would be great to split that day so that the teams are looking at how they can individually implement some of this strategy, and they've got the opportunity to talk about it, rather than it being at that sort of middle management, senior management level.
Yeah, absolutely, really important, fundamental to making sure that we're embedding it and people that are really owning it and recognising where they're adding value and contributing to its delivery. And I know Dion and Cami are working hard together to get that OD plan in place and to embed it in that way across the organisation over the next year. I know that work's fairly well advanced, so we'll be seeing something of that shortly. Thank you. Anything else? Any other thoughts? No? That's okay. All right. So if it's okay then, Richard, if you're happy if I step away, and just please encourage anybody for that final bit of feedback through that QR code, that link. So we'll share the slides after the meeting. But just one last thank you to everybody for the support and the contributions that you've made so far.
Thank you very much, and certainly thank you, Alison, and your team for leading this piece of work across the group. As colleagues have said in the chat, I think we've got a really good product emerging from this. It's very well presented. So thank you, and thank you for your time this afternoon. It's been certainly helpful to have the opportunity to engage with you and to provide some feedback before this then gets presented to both trust boards in March for approval. So as you've mentioned, we will facilitate sharing of the slides with colleagues that have registered to attend this afternoon, and that will also include the link through to the Microsoft Forms feedback form. We'll raise this also at the Council of Governors meeting, which is coming up in a week's time, which will hopefully get some more engagement and feedback in as well. Yeah, look forward to seeing the final product emerge in the boards in March. So with that, then we'll move towards a close for this afternoon's webinar. So thanks very much to everybody that's joined this afternoon for your contributions in the chat and already in the meeting. Really appreciate you taking the time to join us. For those that are regular attenders at the workshops, or even if you're not, actually, you might be interested to know that we've got our next member webinar taking place on the 12th of March. It will be at 5 o'clock, and the subject of that particular webinar is working age carers. Like this webinar, it will be online, it will be free to attend, and we will have some more engaging content for you to get involved in. If you're not able to attend live on the day, then like today, we will be recording the session and putting it up on the Trust's website, so you can catch up afterwards. So with that, thank you very much again for joining us this afternoon, and have a very good rest of the afternoon. Thank you.
Thank you. Bye, everyone.
Thanks, Richard. Bye-bye, everyone.